Have a nice day with such a kind of a wonderful audience. Today, we are moving with a key purpose with our mind to celebrate the birthday of Dr. Reich Geert Hammer as World GHK or World GNM Day. I, Dr. Kamlesh Bagmar, welcome all of you for this wonderful kind of an exchange of thoughts so as to make aware about the Dr. Rai Greed Hammer's foundation and the various concepts which have been involved in the treatment, in the management, in the understanding of so-called illnesses. Let me move with my next slide. So today I am going to share few understanding which talks about that diseases are not contagious. Myself, Dr. Kamlesh Bagmar from Motiwala Homeopathic Medical College. I've been working since last 15 years and since last more than 20 years having an experience in the management of the illnesses along with homeopathy, psychology, counseling, and of course a GHK. So the GHK is really a revolutionary discovery, and it was a revolutionary thought process to interpret the psyche and body. Present system, when we have been talking about, they all talks about the modern science specifically emphasizes the use of a body, and they give an undue importance to the reports and investigations. No doubt the reports, the investigations are required, but their over importance allow us to miss the man in the disease, and we keep on treating the known or unknown pathologies and reports. So with these key words, let us move and understand why diseases are not contagious. The first and foremost disclaimer to all our participants that this information which we are going to present are for educational purpose only. They are not going to substitute a medical professional advice and services which have been required. The students, those who have been seeing and watching these kind of things, mind it well that they are not intended to write in the examination as well. So we talk about the GNM, the sacred medicine. As Michael Faraday rightly told, that nothing is too wonderful to be true if it is consistent with the laws of nature. So the whole presentation is devoted to Dr. Hammer's discoveries which are available, and to make all the population, all the participants, all the listeners to aware about what exactly this GNM or GHK is. So we talk about that when anything which is based on the nature's principle and nature's law, it is going to sustain for years and for centuries together because it is consistent with the nature. So we will try to understand how GNM is consistent with nature, and that is how it will going to sustain. In reality speaking, we talk about the lot of differentiation between the psyche, the brain, and the body, but they are all purely academic. When we talk about the man, a person, they are one and one entity. So when we talk about diseases are not contagious, because nothing in the nature is disease, but it is always biologically meaningful, right? These are the words which have been shared by Dr. Hammer, and these words, he mean to say that there is a biological special program of nature which has been there. So as to highlight all these things, let me give you a brief idea about and understanding about that before 2.5 million years, the microbes were only the organisms and inhabitant on this whole earth. The lifespan of human, animals, and plants, it has started afterwards. So we talk about that the microbes are existing before we started existing on this universe. And we feel that everything which has been gifted or which has been designed by a nature to have its own existence, it should have a meaning. Without meaning, nothing exists on this universe. So naturally, these microbes which have been there since 2.5 billion years are also having some kind of their existence and role to play in our human life. Usually, the whole ecosystem revolves around the symbiotic relationship, and that is the reason why the nature is been having its own existence. Now, rather we feel that due to microbial flora, the man has survived throughout these centuries. If we talk about from conception to uterine cavity to fallopian tubes, maybe to the birth passage and umbilical cord, they are not sterile. The recent discoveries talk about that the human organism is having a lot of microbes inside our body. So if they are there, what is the purpose? What is the role of these microbes which we are having? Of course, these microbes also accompanies with inflammation and swelling and heat and all. But mind it well, the microorganisms are essential for the survival of human being, because most of the microbes, they will not harm you at all. In fact, they will help you to the processes of the human existence, like for example, digestion of a food, like protecting against infection, and even maintaining the reproductive health. So when we talk about all these microbes, they come into harmony and there is a common sense, or they are mutualistic with their relationship. If we talk about the skin, we are having many microbes on our skin, the surface of a skin, in oral cavity, in digestive juices. But all these microbes are having a special function so as to keep a human being in a capacity of a health. So that is why when we have been seeing that the one concept which talks about at the back of a mind with all these new technologies and inventions of the reports which have been there are the diseases are caused by microorganisms like bacteria, viruses, and fungus. But in reality, when we try to understand the evolution of a microbes and a man and a plant and the ecosystem, we feel that there is an essentiality of all these microbes in maintaining and understanding the one's own health. So we take a best example where we are trying to find it out that if a person is been suffering with diarrhea like illness, the modern science will try to prescribe the antibiotics for it, but along with antibiotics they take care to prescribe probiotics also, because these antibiotics will going to kill and harm the protective organisms in our gastrointestinal system, where they are going to protect the mucosa of the whole gastrointestinal system. So naturally we are talking about that the even the vitamins which has been synthesized in our body like folates, riboflavin, cobalamin, vitamin K are all been synthesized by the use of microorganisms, and specifically it has been absorbed from the digestive system. So overall we are talking about that the microbes really play a essential role in our health and in our day-to-day life. So they are natural microsurgeons. So that is the reason where we are talking about that the microbes, they don't cause disease, but instead they play a vital role in healing process of the body. So that is the reason why we are talking about that all microbes and contagion are not going to cause a disease. So we talk about that the number of these microbial cells residing in the human body outnumbers the body cells almost as to 4 as to 1. So they all talk about the symbiotic and indispensable relation. Like we talked about a placenta, one of the most important example which I would like to share in through this is what Dr. Hammer could find it out that there are certain roles of mycobacteria like tubercular bacilli which are essential in the healing process. Most of the time, our understanding talks about that the tubercular bacilli, like Mycobacterium tuberculosis, is going to cause you a tuberculosis. But this is not all the time true. We will see through that human survivals are depending upon the microbes, and really we will see there are so many trillions of the human cells are there, but there are more about 100 trillions of the bacterial cells are there in our body, which has been proved with the recent scientific research. When we talk the today's generation, the obesity is very a big issue, which has been considered to be a non-communicable disease, which has been going on. And I feel that even to treat and to understand the obesity, microbes in our intestine plays a very crucial role. So there are many researches which talks about a person who has undergone a multiple kind of an treatment specifically related with antibiotics and its relationship with obesity, it has found a positive correlation. So we are here to understand that unnecessarily killing our microbial system in our body may provoke for the proper propensity to develop obesity or various kind of an illness. So that is why we talk about that the diseases are caused by pathogenic microbes. This is what doctrine of modern medicine says. But microbes are believed to be a causes of infectious disease. But in reality, you will find it out. It is everywhere the microbes are present and they live in harmony with organisms. So microbes, they require a typical environment in which they will grow. Microbes will need a kind of an environment, maybe it is related with acidic environment or with oxygen or without oxygen. But when we talk about the infection, it is not presumably brought by the imbalanced pH or a wrong diet, but it is the transition. What Dr. Hammer talks about is from conflict active phase, and then it will move into a healing phase. So most of the time we take an example that lot many people are getting suffer with cold and coryza. If we take an example that most of the people, most of the children, though they got wet into a rain, but not all the child suffers with the symptoms. Those where this imbalance takes place, only a few children are suffering by getting wet and suffering with cold and coryza. So actually, is it only microorganisms which are causing the disease? No. So it is rather a conflict which are present, which are getting triggered with some or the other kind of a stimulus, make people susceptible to suffer from the illness. So Dr. Hammer has found this fourth biological law, which is inconsistent, where we have been talking about that the diseases are not contagious, and there are certain fungi, tubercular bacteria, which are present in patients with suffering with cancer. And these bacteria overall try to heal the patients, try to help in the healing process. And that is what was the greatest discovery of the century, which has talked about the Dr. Hammer's discovery. So since the body is not accustomed to this exotic microorganism, the healing symptoms can be quite severe, and we mistake these healing symptoms with a kind of an illness, where Dr. Hammer has given in his whole writing that these microorganisms, when they are existing in harmony with your illness, with your disease condition, will try to protect you, will try to help in the healing phase. So, for example, Staphylococcus bacteria, they support the reconstruction of bone tissue. The Streptococcus bacteria, they rebuild the necrosed tissue in the ovaries. And the bacteria which are also helpful in the healing which has been caused by injuries. So this wonderful discovery and the thought process of Dr. Reed Hammer really put insight into all of us to think about, are all diseases contagious and caused by microbes? No. So all these microbes rather play a very crucial role into the economy of a man. So we talk about this, the whole system where the bacteria, fungi, and microbes are present, and they are having its action on the skin or on the bone or on the memory tissue and so on. So really, these microbes are the natural microsurgeons what we are being harbored with. Now, there are researches which talks about that the microbes role in the wound healing. So naturally, the wound and the healing process of the wounds are really been carried out by the help of microbes. There are now the recent generation papers are all talking about that overuse of antibiotic is one reason why more patients of the cancers are found. So this all researches in the present era really talks about that when to consider all the researches and all the causes of the illnesses as microbes should be changed. The concept from our brain as a human being, as a treating listener, as a physician should change. Rather, these infectious diseases are not caused by the microorganisms. Rather, it is a psych trauma which is evident on the soma. So that is why we are talking about the plenty of the illnesses are now been termed as to be a psychosomatic in origin. So cancers are reversible where microbes decompose a tumor starting from the center. Hence the clinically you will find it out the centrally necrotizing carcinoma. The fungi, the bacteria are all acid resistant, which allows them to survive in this whole acidic environment of a GIT, lung, and water. So this all are what we are talking about is the awareness is been required. And it is also been told that awareness is the greatest agent for change. And hence, when we think about the awareness of the concept which has been proposed by Dr. Hammer has to be understood in reality and has to be practiced and applied in day-to-day life. And then only we can tell, we can remove the fear from our patient's mind that all diseases are not contagious. The diseases, the so-called diseases having given a name, various name, but actually it is some kind of an turmoil which is going into the mind and the body. Somewhere the one precipitating factors goes inside it, it hurts. There is a hammer hurt, what we call it as, and which proposes the formation of illness. So today the overuse of antibiotic is one of the reason why many more cancers we are finding it out during the routine examination. So this our learning is ever changing learning, and I hope it will going to be gets continued with the help of and the knowledge of Dr. Hammer. If everybody will try to integrate and find and support and read and try to heal yourself with such a kind of a beautiful knowledge, it will be a nice tribute, and it really will going to give us the way how we can able to imbibe the presentations, imbibe the things which has been proposed by Dr. Hammer. So I'm very much fulfilling this whole idea and the concept. I'm having a great gratitude to my principal, Dr. F.F. Motiwala, the president of Global GNM, Dr. C.J. Varghese, all my teachers, students, and patients. With a greatest gratitude, I am sharing this video to all of you. And thank you very much.